The Michigan Department of Corrections is hiring, and they have a hiring event coming up at Albion College, and this will be open interviews 9 a.m. to 5. Tomorrow, January 19th at the Sarah Fitness and Dow Rec Center in Albion. And corrections officers starting at over $20 an hour. And as we have learned, plenty of opportunities to grow within the MDOC.
Joining us now from IEP Urgent Care Emergency Services Physician, Dr. Jacob Sinkoff, and from Henry Ford Jackson Hospital Resident Physician, Dr. Jory Johnson. Welcome to the show.
Hey, good morning. Good morning. Thanks for having me back.
Yeah, Jackson has a huge number of residents that are training right here in Jackson, and you're part of this current crop.
Yeah, fortunately I am, yeah. So.
How did you end up at Henry Ford Jackson?
So, yeah, that's a great question. So, emergency medicine is just real popular in the state of Michigan. Back when I was in medical school, I was looking at programs or states that would, accommodate families, because I got a wife and kids. So, yeah, and ended up in Michigan. Then I ended up just rotating at the hospital for a rotation while I was during med school, and that sparked my interest in the community and the hospital.
What's it like as a resident, kind of traveling around? You kind of don't know where you're going to end up, and things like what's that like going? Obviously years of schooling, a lot of travel. Talk a little bit about that.
Oh yeah. So I mean, if this is something that you really want, like if you're one of those types of people that want everything written down and follow that schedule, it could be a little hectic because you have to make a lot of changes. No, it's a fun roller coaster. Mm-hmm. Sometimes you just got to go with it.
Yeah.
Yeah, that's what I remember about my experience. We've had the residency at Henry Ford Jackson now for 10 years. We're coming up on our 10-year anniversary. Wow. Since our training programs all started. And I was actually part of the first residency class in Jackson.
Wow.
So, but yeah, the experience of traveling around the state, not knowing where you're going to end up next.
Yeah.
I wanted to stay in Michigan, but there's, people travel all around the country looking for a place for residency in the specialty that they desire. And coming up in February, I believe it's February, right? They have what's called the match, which is where applicants apply to programs, and programs rank those applicants based on what specialty you want, and then the locational specialty. So we've already done our interviews within the program. Usually those happen at the end of the year, and then all the applicants form what's called a rank list, and all the programs form a rank list, and they do some algorithm, and then you get matched and you go wherever they tell you to go. And it's a scary but exciting time. And then you get started, and we get to have emergency medicine residents for 4 years, like we've had Dr. Johnson for 4 years.
That's awesome.
So you're his mentor. You have he gives you the paperwork.
No, he helps me out a lot. He helps, not just me, but all the other residents as well. So you get, we call them attendings, but they're board certified emergency medicine physicians, and they train the residents.
Now, being an emergency medicine physician, isn't there even a subspecialty of that you're studying?
There can. So there's fellowships that you can look into after residency. Like you could do critical care.
Toxicology is another one. EMS are other ones that you can kind of go in afterwards. Some of our other programs, such as internal medicine, they have a lot of fellowships also. So you do your 3 years of internal medicine, then you do a fellowship in cardiology if you want to be a cardiologist, or a fellowship in gastroenterology if you want to be a gastroenterologist. So we've had a couple residents go in the past go into ultrasound fellowships, which is another emerging popular thing to do. So we've had residents go in that. We've also had a couple residents do a wilderness medicine fellowship for a year afterwards. A lot of our emergency medicine residents are very outdoorsy people. Kind of goes along with everything. So I think we've had 2 residents do that also, and a lot of the residents just kind of once they graduate, they become board certified, and they start working all around the country. And we try to keep as many as we can in the community and in Michigan for sure. But we've had, I think from our program, 4 or 5 residents become attendings here in the community, and that's the ultimate goal through I think all the programs at Henry Ford Jackson is to recruit physicians to the community. And I think we've done a very good job, and we'll continue to do that.
However, you are headed somewhere south once you're finished here.
Yeah, so I signed with the hospital down in Arkansas. So
Very good. Cool.
So we're
well,
excited
we wish
about
you
that.
the best,
I appreciate
best down
it.
there. Let me ask you a question while I have you both here. How do we know if it's an IEP visit or an emergency room visit? Give me a few examples. Let's say my kid breaks their leg.
So that's a good question too. So so the difference between going to the urgent care or the emergency medicine, sometimes it's hard to tell. Even if it was my own child, I'm like, I don't know.
Yeah.
First of all, always happy to see people in the emergency department.
Right.
So there's no wrong answer for going to the emergency department. At the urgent care, we do have X-ray capabilities. So anything that's just is fractured and the bone's not really displaced or anything like that, we could splint up at the urgent care and refer you to one of our orthopedic specialists. Anything that might need to be what we would call reduced or straighten the bones out a little bit would require sedation. That would be more of an emergency department visit. And if you go to the urgent care and it's deemed like, hey, this probably needs a higher level of care, our urgent care will call the emergency department. So the emergency department will be expecting you. The physician, we'll have a physician-to-physician call. So
Golden ticket.
Exactly, kind of the golden ticket type of deal. So everyone has those proper expectations. But that's a lot of times the ultimate question. The other thing, that we can do at the urgent care is you can get vital signs, and they can kind of triage from there.
Okay.
So I don't think there's a really wrong answer per se, but some of the capabilities of the urgent care, stitches, we can splint. There's X-ray capabilities, obviously COVID, flu testing, stuff like that are very easily handled at the urgent care. And we've been extremely busy, so I just want to plug that you can do your get online appointments through the urgent care through the website, which really helps too.
Were you there this week?
Well, you could be. I think you could better answer that question because you've been to both many times.
Yes,
Yeah.
but
how do you decide which
not
one
as
to
a
go?
patient.
His punch card's almost
I go
full.
where
His punch card's almost filled up.
I go wherever the patient is. If I have been to both places many times, many times.
Have you had some unusual challenges working in the ER here?
I think every time you walk into the emergency department, you can find yourself with some some interesting stories.
Yeah.
But particularly here, it's been fun. There's some fun stuff.
What's a common thing that folks come to the ER that maybe they don't need to go to the ER for?
Well,
it's kind of an interesting question.
Yeah, that is. No, that's a great question. I think one of the things would be, I think some patients kind of contemplate like, should I be going to the emergency department, or can I go to the urgent care, or is this something that can be addressed with their primary doctor or not? And then they kind of are indecisive, and then they wait, and then unfortunately, I think they've waited too long.
Sure.
And then they just get more sick. So it's something called sepsis, but it's just like a systemic infection which will start somewhere and then spread to the rest of the body. And if you wait too long, the more sick you get.
Yeah, I think that's a great point. Is at least getting seen by someone, whether hey, let's schedule a family doctor appointment, and then they can see and say, hey, maybe you should maybe you need to go to the emergency department. I think is something smart to do. The other thing too, a lot of times is chest pain. A lot of times people put off it's it's indigestion and stuff like that. And a lot of times that we have a lot of testing capabilities that at that point the urgent care doesn't have, and they would maybe send you with chest pain. So I think that's something that shouldn't be ignored.
Yeah, if someone asked you, do you think you should go in? The answer is always yes.
We would never say no.
Oh, wait. Yeah, you're not turning people away.
No way.
So we're in the winter respiratory. We've got all this stuff going on. Flu, RSV. I've had it.
Yep.
You're an expert on it now.
Yeah, I'm an expert on it. I know you can't do anything about it.
No, and that's what's so terrible is, explaining to parents is the duration is so long, it can be up to 3 weeks of just this cough. And yeah, it's like a pneumonia, but there's no treatment for it. You can't give it. It's a virus, so antibiotics don't do anything.
Yeah.
They've done studies on every possible treatment. They've done studies on steroids, on breathing treatments, and really the only thing that really works is what consider supportive care. Yeah. So Tylenol, Motrin, especially on infants, suctioning the nose to kind of open the nasal airways because you get copious amounts of nasal drainage. So that's what makes RSV so frustrating. Is just there's not really a great treatment, treatment for it. But it's important, obviously, to get checked out by the family, so oxygen levels can get checked and all that, and evaluate breathing.
And the chain pharmacies are now they've dropped the limits on some of the children's medications.
Yeah, it's very very hard to find Tylenol, Motrin also. Yeah, so very difficult.
Jory, in your rotation here at Jackson, what have you liked about our community?
The community is great. So I have kids in this area, so they go to Dibble Elementary. They do sports, extracurricular activities at the YMCA. My oldest daughter, my oldest kid, she does ballet, but she travels to Chelsea for that. So I mean, the moment we moved here, we got right involved in community activities and stuff, and we love it.
Yeah, well, it's great. I want to thank you guys both for being here. You better start looking for a ballet school in Arkansas. I hear that they fill up pretty fast.
You say that, but my wife already found one. So.
Thank you guys so much for being here. Resident physician, Dr. Jory Johnson, and from IEP Urgent Care, Dr. Jacob Sinkoff. More of the morning show right after this.